Hi friends, welcome to classes by Lab Doctor. I'm Dr. Divya and in today's class let us discuss about the serum creatinine. So what is serum creatinine? So creatinine is a waste product in your blood that comes from your muscles. So after the muscle metabolism, when the muscles they use the energy, they will produce some amount of waste product, and this waste product is called as creatinine. So healthy kidney will filter this creatinine out of your blood through your urine. Your serum creatinine level is based on a blood test that measures the amount of creatinine in your blood. That is the serum creatinine test. It tells us how well your kidneys are functioning, and when your kidneys are not functioning well, your serum creatinine starts rising. You can also measure the serum creatinine in the urine, that is urine creatinine levels. This creatinine is the waste product from muscle metabolism. So once this is produced from the muscle, this is excreted in the urine. So the creatine is converted to phosphocreatinine and creatinine, and this creatinine, which is a waste product, it is excreted by the kidney through glomerular filtration. The glomerulus, which is a filtering unit, it will filter it. No tubular reabsorption, because it is a waste products, we are not going to reabsorb it. So kidneys are not going to reabsorb it. Some amount of tubular secretion, around 5 to 10% of creatinine is secreted. So let us understand the bit of biochemistry and physiology of this creatinine. I've told you that creatinine is a waste product of creatine metabolism. So it is the creatine which is there in the muscles which gets converted into the creatinine. So small amount of this creatine you will also get from your dietary sources, principally the cooked meat. When we say that, that has proteins in it, and that also has creatine. So this creatine is secreted. This creatine is synthesized in the kidneys, in the liver, and in the pancreas by enzymatically mediated reaction, and this creatine is transported from the blood to the muscles. So sometimes you will see even the people who work in gyms, etc., they will be taking this product that is called as creatine. So that is the one which will give energy to the muscles. That is why it is taken. So some amount might come from the food, otherwise this is synthesized in kidney, the liver, the pancreas. From there this creatine will go to the blood, and from the blood it goes to the muscle. So here what happens, this creatine is converted to creatine phosphate as well as this creatinine. So this, in this process, this phosphorylation to creatine phosphate, there will be this generation of ATPs. So this is the one which is providing the energy. Once there is ATP generated, that means there is energy. So this production of energy happens in the muscles. That is why when the muscles are able to contract and do their function, so this is the main source of energy for muscle contraction. So that is how this creatine is utilized, and once it is utilized, during the process of utilization is the ATP produced, which is helping the muscles to contract, give it strength, give it the energy, and then it is degraded into a product called as creatinine. So now creatinine is the waste products. So this is the creatine which is phosphorylated to phosphocreatine, and then the forms the creatinine. This is a waste product. I've told you it is filtered through the glomeruli. It is excreted in the urine. Daily around 1 to 2% of creatine in the muscle is converted to waste products. So the production of creatinine will depend upon the muscle mass. So आप आगे देखोगे ये जो creatinine का लेवल है मेल्स में ज्यादा रहता है, फीमेल्स में नॉर्मली वो थोड़ा कम रहता है, क्योंकि मसल मास जो है मेन में ज्यादा रहता है बिकॉज ऑफ दिस टेस्टोस्टेरोन हार्मोन एक्सेट्रा. तो उसके लिए जो नॉर्मल रेंज ऑफ क्रिएटिनिन जो है वो मेन में ज्यादा रहेगा compared to females. So daily 1 to 2% यहाँ से ये creatinine होता है and that is excreted in the urine. So the amount of creatinine produced will depend upon the total muscle mass. So this is how it is, I have told you. So the liver, the kidney and the pancreas are the one which convert creatine. So creatine also comes from dietary sources, that is red meat, etc. So this creatine is then through the blood circulation, it gets thrown to the muscles. In the muscles, to get energy, this creatine is converted to phosphocreatine and the waste product is produced, that is creatinine, and this creatinine is excreted from this kidney. So although there is variability between individuals, I've told you because of the muscle mass, the given individual, the daily creatinine production remains pretty constant. So creatinine is cleared from the blood by the kidneys principally during the glomerular filtration. I've told you it is the glomerular filtration which will be doing the main clearance of the creatinine, and around 5 to 10% is also secreted, but no creatinine is reabsorbed from the kidneys. So this is the normal range. In men, I have told you it is slightly higher, 0.6 to or 0.7 to 1.2 is normal in men. In women it is slightly lower because of less muscle mass. In teenager and children it is still less because of the lower muscle mass. And this is a creatinine in the urine. In men it is around 107 to 139 ml per minute, and in women it is around 87 to 107 ml per minute. So why do we need serum creatinine test? So first is to make a diagnosis of suppose if you have any symptoms related to kidney disease, if you are a diabetic, if you are a hypertensive, in that condition to see if you have developed any kind of a kidney disease, to see the treatment or progression of the disease or monitoring of a treatment, side effects of a drug, or if you want to monitor the functions of a transplanted kidney, etc., we need serum creatinine. Now, what are the conditions wherein you'll get high serum creatinine? So, definitely it is a measure of kidney function. So, whenever the kidney has failed because of a kidney trauma, kidney infection, kidney damage that can happen because of diabetes, hypertension, drugs, autoimmune disease, kidney failure, etc., the serum creatinine will rise. In case of dehydration, serum creatinine will rise. I've told you it is a byproduct or it is a waste product which is generated from the muscle. So whenever there is a muscle destruction, rhabdomyolysis, suddenly एक दिन में creatinine बहुत ज़्यादा rise हो गया, तो we should always think whether there is a muscle lysis, like कोई accident हो गया, crush injury हो गया, तो large amount of muscle is destroyed and the serum creatinine will rise very high. In pregnancy, because of pregnancy complication like in eclampsia, pre-eclampsia, etc., some condition that affect the kidney like in heart failure, diabetes, if a person has consumed large amount of meat, etc., if the person is taking creatine supplements, if the individual has done a very high intensity exercise, if he's a bodybuilder, then also the level of creatinine might be slightly higher. Certain medications, certain drugs like fenofibrate or cimetidine, this can also cause increased creatinine in the blood. Now, why do some people have low creatinine? So, low creatinine happens, suppose if you are on a very vegan diet or a vegetarian diet, sometimes your creatinine might go low, or you have a very low muscle mass, you're very young, a teenager, very old, or you have cachexia or very much malnourished, then also the creatinine level can be low. In pregnancy, sometimes the creatinine level goes down. If there is a history of an amputation or there is a muscle wasting disease, muscular dystrophies, creatinine level can go down. If there is severe liver cirrhosis, then also the creatinine levels can go down. So this is a relationship between the GFR and serum creatinine. जैसे जैसे glomerular filtration rate कम होते जाएगा, सीरम क्रिएटिनिन लेवल ज़्यादा होता रहेगा. ये इन्वर्सली प्रोपोर्शनल है. GFR कम होता गया, serum creatinine will start rising. Though serum creatinine is a very common test which we order to assess the kidney function. Just by looking at the serum creatinine level, you cannot tell that your kidneys are perfectly normal or perfectly not functioning. This is because the normal creatinine level in the blood can change because of various factors I've told you, depending upon your age, depending upon your sex, depending upon your body size and other factors. Some people उनका normal creatinine level आ जाएगा but actually उनको kidney disease रहता है, and some people will have a high creatinine but may not have that kind of a kidney disease also, or it might be less severe than what it seems. So it is always better we correlate it with other findings also, like the glomerular filtration rate, creatinine clearance, etc., and also the patient symptoms, other clinical findings, and then come to a conclusion. I have also told you that जब तक किडनी ऑलमोस्ट एक 2/3 या हाफ ऑफ द किडनी इज नॉट फंक्शनिंग, तब तक ये पैरामीटर्स ज़्यादा चेंज नहीं होते. तो अगर पेशेंट का क्रिएटिनिन नॉर्मल आ गया तो हम डायरेक्टली ये नहीं कह सकते कि हाँ पेशेंट का किडनी बिल्कुल ठीक है. अब जब भी कोई भी पैरामीटर्स को आप इंटरप्रेट कर रहे हो, यू हैव टू कोरिलेट मेनी थिंग्स, especially the patient's symptoms, his history, other findings, associated special tests, etc., to come to a conclusion. Because all these parameters depend upon many factors, including the age, the gender of the patient, etc. So, we have to always remember to correlate the blood test clinically. We need to correlate all the findings to come to a conclusion. So that is all about serum creatinine blood test. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.